David, thank you very much for having me. It's an honor to be here, and I think that the discussion that you're having is incredibly important. I'll tell you a little bit about maybe why I got invited out of 535 members of Congress, and then really we can have a discussion that's more wide-ranging than my own experience. I actually gave a speech in Boston on Monday morning, about the types, in large part about the types of communities that we live in and some of the effects that they can have on public health as well, and what the drivers of, what the public policy drivers are of those types of communities. So lots to discuss. But the reason that I'm here, and I appreciate the kind introduction and everything, is that I ran for president, as many Democrats have in this cycle, and I became the first presidential candidate in American history to talk about dealing with mental health myself. And I did that, frankly, because I figured, if this catches on and I'm successful, then this is going to come out, and so I'd rather do it on my own terms. And I say that humbly because I admit I did not have the courage to share this story before. Frankly, I was afraid when I was running for Congress that if it came out that I had sought treatment for post-traumatic stress after 4 tours in Iraq, that I would be disqualified. And I didn't know if telling that story on the campaign trail for president would end my bid that week. Instead, the response has been fantastic. It's been extraordinary. We've held veterans town halls across the country where veterans, not just of this current war, but of wars as far back as Korea and Vietnam, have started telling stories that they've kept silent for decades because they haven't felt like they could share them. To have Vietnam veterans come up and say, Seth, I haven't told this story for 60 years, but if you're going to tell your story, I'll tell mine. And then have them go and seek help has been extraordinary. And the effect has been well beyond veterans. I've had people reach out to me from all across the country. An example is someone who said, my son died in a car accident 6 years ago. I've never been able to talk about it. And I realize now that I need to get help. And so that experience, I think, is the most important thing that I did running for president. I was talking about national security. I was the only combat veteran running. I think there are some other things that distinguished my candidacy, but if there's one thing I can point to that I'm proud of, it's talking about mental health. In conjunction with telling my story, I released a 3-point mental health plan that I would seek to implement as president. And I'm proud to say that we've actually made tremendous progress on that plan, even since I dropped out of the race. The 3 points are, 1, to establish a national mental health hotline. That is a bipartisan bill that I have co-authored with a Republican Air Force veteran from Utah, and it currently has over 100 co-sponsors on both sides of the aisle in the House. It has co-leads in the Senate, and we've had positive discussions even with the White House about getting that written into law. The second piece was to ensure that everybody in the military gets an annual mental health exam. And the reason for this is partly because we obviously have a mental health problem in the military with the suicide rate and whatnot. But I think more importantly, to simply establish that it is a routine, normal thing to get checked out for mental health. And that's why we insisted on this annual requirement. We're already moving in that direction. In the House version of the defense bill that is currently in conference with the Senate today, we have a provision to ensure that everyone who comes back from a combat deployment gets seen by a mental health professional within 2 weeks, and then gets seen on a yearly basis thereafter. To fully implement this across the military and with the VA will cost some significant amount of money, and we'll have to recruit more mental health professionals to do so. But the fact that in the course of a few months we've already made significant progress on this, I think, is quite meaningful. The third plank of the plan is to extend this idea of annual mental health screenings to every high schooler in America. And we've received a lot of feedback. Look, this is not something that we proposed in a vacuum. We did a lot of research on it. I'd say the most common piece of feedback we received on that plan is that it's fantastic, Seth, but you might want to think about starting even earlier. And that obviously is a huge appropriations to accomplish. But the fact that people are now talking about it and literally talking about it across the country, I think is significant progress. So that is my own little story, and the work that I'm doing in conjunction with it, now back in the House of Representatives as a member of Congress. But I'd be happy to take the questions and discussion wherever you'd like. So should we just open it up?
Sure. We will certainly open the floor up to questions. I'm happy to open the discussion up with that introduction. So I'll look around the room, and I see we already have at least one question, and I've got a couple in my back of my head here too. So by all means.
Thank you so much for sharing your story. I wonder if you might elaborate on the annual checks, because we recently I'm from the American Medical Association, and we had a conference around well-being of healthcare providers, and the idea of mandated annual checks for our medical students was raised and immediately quelched based on concerns around privacy and adequacy of interaction when you do find things. So I'm just curious if you might elaborate on the plans that you've had and the discussions around that.
I mean, look, I'm not a doctor, and I'll throw that caveat out right away. And I don't understand the full background to the quick story you just told. But from hearing you explain, like, okay, the idea was immediately quelled for privacy concerns. I mean, this to me is exactly why we want to do it, because the point is that right now there's such a stigma against this. That people are not. Look, if I were to say, hey, I'm sorry, I've got to leave 15 minutes early because I've got my annual physical, none of you would say, oh my God, what's wrong with you? But if I were to say I've got to leave earlier because I'm going to a mental health appointment, the reaction in the room would not be the same, even if you didn't say it. And that fundamentally is what we have to change. And the point to me is not just about checking for problems, but in the same way that you go for a physical, even if you're perfectly healthy, and the doctor says, well, hey, are you exercising? Are you eating well? U.S. Army Special Forces have started doing this, the elite troops, focusing on things like meditation because it makes them better warriors. So there is a very proactive, preventative component to this as well that I think is entirely analogous to why you go for an annual physical, even if you're not feeling sick. I'll give you another example. These are, particular to the military, but I think it gets to the heart of what I'm talking about. One of the issues in the military right now is that it's very easy to lose your security clearance if you express any concerns about your mental health. It's very hard to get a security clearance if there are any concerns about your mental health. And of course, the irony is that some of the people who are on the front lines doing the most dangerous work are people with high security clearances. I mean, I had a top secret security clearance in the Marine Corps. But if I had talked about this stuff on active duty, I probably would have lost my security clearance immediately, which means that some of the people who need care the most are not getting it, are not seeking it. How different it would be if everyone got a mental health exam annually, regardless. It doesn't matter if you have a top secret clearance or not, you're going to get a mental health exam, so no one thinks it's out of the ordinary that you're checking in on your mental health. And to me, that's exactly what we're talking about here. We want to make this routine. Why is it that checking out this shouldn't be as routine as checking out everything else in your body? Does that answer your question?
Yes, I think that's very helpful, and I think that is the premise that the people who are proposing this are acting from. And it is actually taking place at some medical schools, and so it would be very helpful to see the response. But it was for that exact explicit purpose, the same idea. I mean, how could you not struggle with what you went through in your service, and how can we not struggle with what we do on a day-to-day basis? So I think the idea of normalizing it and fighting against that stigma is really critical.
Yeah. You'll notice that I talk about post-traumatic stress. I choose not, a lot of veterans choose not to use the last word disorder. And that's because a good friend of mine in the Marines, who was when we were in the same platoon together, he said to me once, Seth, after what we went through, it would be a disorder if you weren't affected by it. Now, some of the people who spend their lives buried in the dictionary of medical terminology or whatever have objected to my my change, but this is all about the same thing fundamentally, which is that we've got to end the stigma. I think that writ large, with regards to mental health, there are two problems, or you could say a lot of the issues in America could be put into two buckets. One is access to care. People just don't even know how to get care. How many of you know what the National Suicide Hotline number is? It's amazing. We're talking about mental health and no one in the room knows. No one can tell me? You can't tell me the 1-800 number? One person? You try?
1-800-27-HELP.
Okay, you're apparently right. I don't even know it myself. But that's extraordinary, and you're the professionals, right? If you wake up tomorrow night and God forbid your house is burning down, you don't have to go looking for a phone book to figure out who to call. Everyone knows to dial 911, and that's the whole point of my bill. It's actually 988. We did a government study and came up with, they examined all different possibilities for a 3-digit number and determined 988 would be the best one. And we're trying to get that passed into law so that everybody knows if you or a loved one has a mental health crisis, you don't need to worry about trying to find someone who knows the suicide hotline. You just call that number and you can get help. So that is an example of something in the bucket of getting access. A lot of people in the military don't know how to go to the VA. They don't know how to ask someone in the military for mental health care without getting in trouble, et cetera, right? But the whole second bucket of concerns is just around the stigma. It's even if you know that number, you're scared to call. And you really have to have policies to address both issues.
Hi, thank you for being here and for your service. Pam Jeffries, Dean of Nursing here at George Washington University in D.C. You mentioned behavioral health and getting into the high school and maybe doing mental health assessments. Where there's a great opportunity, I think, is with school nursing. Mm-hmm. First of all, school nurses, they see hundreds and hundreds of students, and many have behavioral health issues, and they can't even get around. And some schools have one nurse that shares with 2 schools or 3 schools, so we're just really, really limited in that population. And I like the notion of starting early. I mean, you hear about suicide all the time with the adolescent and social media. It's outrageous. So I just wanted to put that on your radar about that health care professional, the school nurse, and what that team would look like, having a behavioral specialist and all that.
Yeah, Pamela, thank you very much. One of the biggest challenges with these 2 proposals, both for the military and for even more so for the civilian side in high school, is that there just aren't enough mental health professionals in America right now. Now, there's 2 ways to go about this, and I've only been in Congress 5 years now, but one of the things I've learned is it's better to set the goal and say this is something we want to achieve, and then we'll figure out how to get the people to fill the spots, rather than to say, okay, we're just going to train a whole bunch more mental health professionals and hopefully we'll pass the legislation 10 years from now to put them all to work. Right? So I acknowledge that it's going to be challenging at first to simply fill all these positions if we set this requirement. One of the things I think is important, though, is, look, I'm all for school nurses doing this as long as they're trained as mental health professionals. And I don't, the military thinks that they can meet this requirement by simply going to your annual physical and having your primary care physician asking you 2 questions about whether you're feeling like you're going to kill yourself. And that is not what we're talking about.
Saw your hand go up, sir.
If you could use a mic, that would just help everybody else hear.
Can you tell us a little about the political process that you envision so that this goes from an idea that's neat to law?
I was hoping you'd drag out your question a little bit longer so I could get the water.
I
heard it. I heard it.
Okay,
so this is something that I've learned you have to think about a lot in Washington, and really there's 2 primary. There's 3 real reasons I think why critical to this plan is starting with veterans, and a huge component, literally one of the 3 components of my 3-point plan, involves active duty service members and veterans. The first is that there's obviously a need. The second is that veterans and I should say active duty folks, military members set a great example for the rest of the country. And the third is that everybody in Congress wants to help the military. And that's why we think that if we can make this an annual requirement for everybody in the military and start there first, that this is likely to get picked up as, wow, what they're doing is a good idea, and this should be adopted around the country. This has been true with other, the military has led on a number of social issues and some health issues as well in the same fashion. I mean, the obvious example that everybody points to is that the military was integrated long before we got rid of segregation throughout the rest of America. But they set a great example for why it makes sense, and I think the same could be true here. Sorry, explain your question a little bit more then so I can understand.
You before said you weren't, in healthcare. I'm not in legislation, but my understanding is that you have committees in Congress, you have two houses, you have two parties, and I'm not sure how this plays through between being a good idea that people are receptive to in general because it involves veterans versus, and then actually makes it through the legislative process.
Well, what your question is one of the things that's been very challenging for doing just about anything in Congress these days. But let me use the 988 bill as an example. The first thing we did is we found a co-sponsor for the legislation across the aisle. And that's why Chris Stewart and I are working on this. He, a Republican, myself, a Democrat, both veterans, but it's very important to have both sides bought on. Now, my office, led by Olivia, who's actually here right now, has done extraordinary work getting co-sponsors onto the bill, and we've been very careful to make sure that we're not just getting a whole bunch of Democrats and no Republicans. We want to make this very bipartisan. Making legislation bipartisan is not only the best way to get it passed, but the best way to make sure it sticks, and that the next administration doesn't come in and just undo it. The next step is to make sure that that we've got some people on the Senate on board, because if you've been following politics at all lately, you know that there are a lot of things the House has passed that then just go to die in the Senate. And so we've done that. We have co-leads in the Senate. And then, of course, the third piece is you have to get it signed into law by the White House. And it turns out that this White House is not the easiest to deal with on various issues. But we have actually had very positive discussions with a panel that the president has established on veterans' health. And the chair of that panel is not just a political appointee. She knows what she's doing, and she is very supportive of this legislation, which gives us the confidence that if we can actually get a vote in the House, it will pass, a vote in the Senate, McConnell might actually let it through, and then the president might actually be willing to sign it into law.
Thank you.
Yes, sir.
Congressman, thank you for your service. Just this is more of a comment than a question. I'm from San Antonio, Texas, and I'm sure you're aware the Texas legislature just approved a bill this summer that requires every teacher in Texas to have mental health training. And so the universities are now all instituting mental health training at the state level. And for South San Antonio ISD, which is one of the poorest ISDs in the state, students had a protest this summer and required the school district to institute a mental health clinic. So it's just the idea of the grassroots effort that you're doing at the federal level that we see happening also at the state level. And how do we continue that movement and push it through? Because I think your idea about training for students in schools is incredibly important.
Well, thank you very much. And I mean, look, let me just acknowledge that the public perception of this issue really is changing. And I don't think that if I had shared my story of post-traumatic stress on the campaign trail 8 years ago even, that the response would have been the same. So there's still a long way to go, as your experience with the AMA has clearly demonstrated. But there is real potential for progress here, and it's not just liberal Democrats or whatever who are pushing this issue. The fact fact that there's so much Republican support for both. In fact, my provision in the defense bill passed without even a vote. They didn't even have. They said we don't even need to vote on this. We're everybody's on board. So it essentially passed unanimously. So that's incredibly encouraging. And what we want to do is tap in and support this grassroots effort as well.
So, in keeping with our theme here, and I will get to other hands, we're wanting to teach our students how they can be part of this process and what they can do to help when we agree that something is a good idea. So can you maybe help us think through what our role as educators is with regard to our health professional students in becoming a part of this process?
You know, to the gentleman's question about how you get this stuff passed into law, the first bill that I passed as a member of Congress was the Faster Care for Veterans Act, which just improves access to the VA. Without going into all the details, it makes it easier to make appointments and whatnot, bringing some technology into the VA that hadn't previously existed. And one of the ways that we got that passed relatively quickly is that a veteran who was on my staff was calling and trying to get an appointment at the VA, and he was listening to this recording that said, you know, if you want this, press 2, if you want this, press 3, and then we go to 6, and then we go back to 2, and 3, and he got this endless loop. And someone else in the office made this video of him, which went viral. And other members of Congress started coming to me saying, hey, everyone's talking about this bill that you got, Moulton. Can you sign me on? And so Olivia's doing hard work, literally calling offices. There's so many bills out there that sometimes it's hard to just like get people's attention enough to get them to be supportive of it. But one of the things you can do is if people in the community, if activists like the folks you described down in Texas are pushing for this plan and say, you know, hey, Moulton's got some good ideas here. We need to get this hotline bill passed. We need to work on this annual requirement. That will really drive the other folks, my colleagues, as much as me going to them and saying, hey, this is a good idea. Because frankly, we go to each other all day long and say, hey, this is a good idea, get on this bill, get on that bill. But the point is, people at the grassroots level can truly make this a priority.
Good morning. How are you?
Good morning. I'm good. How are you?
I'm a Navy veteran, and I understand the behavior health part of the PRQ that we go through every year. And as a veteran, I'm finding that a lot of people are not literate about behavioral health. So I know a lot of us have started like mental health first aid workshops to get the public aware and understanding and trying to downhaul that stigma, because even on the veteran side, we still have training such as suicide awareness, but we don't have mental health first aid, which is free to some, but not free to all. Mm-hmm. And part of your bill, could you add something like mental health first aid as a free service to everyone that's going to be serving the public?
That's absolutely something that we can consider, and we're considering a lot of other pieces of legislation associated or accessory to these sort of three main points, these three main drivers. An example, back to the story from Texas, is we did an event with some first responders. And there's a police department actually where I live in Salem, Massachusetts, where they have 2 people on staff who are full-time, have gotten extensive mental health training, and when there's any sort of mental health related incident, they get called to the scene. And we said, this is a fantastic idea. I'm very proud that Salem, Massachusetts is doing this as a leader on that. But when we brought these 2 officers in, they said, honestly, a smarter approach would just be to have every officer get this training. And they said, you can do it if and they know a lot about police academy training. They said this wouldn't actually be such a heavy lift to add this into the curriculum for every police officer going through the Academy of the United States. So we haven't gotten to the point of actually writing legislation on this, but this is something my team is working on, literally as we speak, to see if that's another thing that we can do to help address this.
Good morning. Thank you for being here, first of all. My name's Lisa Howley. I'm with the Association of American Medical Colleges. And you could not have set me up better, the last question. Thank you. So thank you for your service as well. That's one thing I wanted to ask you about was mental health first aid and how your legislation would relate to that, if at all, or how it could kind of build on that existing legislation, the Mental Health First Aid Act. So that's one question. And then the second was your thoughts on integrating mental health first aid into all of our curricula.
Mm-hmm. Well, I mean,
For
first of all, I
health
think that this is all very complementary. There's no question that this is all driving towards the same goal. And look, I mean, as I said to the Navy vet, where is she? Candace, who asked, this is something that my office will explore more to see if there are more direct connections rather than the obvious complementary connections in these pieces of legislation and approach and whatnot. But one of the things I'm very careful to say when I talk about 988 is that it's a mental health hotline, not just a suicide hotline. And I think that that's a mindset change that we really need to get through to everybody in America, that you don't have to be contemplating suicide to get help. And I say that from very personal experience, because one of the reasons why it took me a long time to ask for help to deal with my own post-traumatic stress is because I wasn't feeling suicidal. I wasn't driving down the highway worried that a bomb would blow me up back home in America. I was not having nearly as bad symptoms as many of my fellow veterans. And therefore I felt, maybe I don't even have post-traumatic stress, or at least I'm not the one who needs to get help here. Why would I be taking resources away from someone who might actually be about to kill himself? So this is a mindset change that I think we need to get through as part of this whole big push. Thanks.
Staying over here quickly. Thank you. My name's Darren D'Agostino. My day job is in Kansas City, at the Kansas City University. We have a program called Score One for Health, which actually screens children for physical health. And over the last 4 years, we've moved into mental health screening at the elementary school level. We have about 14,000 visits a year. The scary part is these are children that we're uncovering 3,500 to 4,000 issues of secondary disease, disease that could kill them, hypertension, diabetes, prediabetes, and it's scary. But the mental health we're uncovering is also very scary. These are oftentimes impoverished areas, and so the resources to get them to places, the pinch point is even tighter when we're dealing with child and adolescent psychology and psychiatry. And so I think, just as a comment, this is a great idea, and I think it will uncover the next big expansion of healthcare professionals. And so the driving force will be there.
Well, thank you very much. I appreciate that. We only have a couple of minutes left, and I want to take your comment to make a point that might sound like a bit of a divergence for us, but I think it's really important. The whole point of this conference, as I understand it, is to talk more broadly about all the different social determinants that go into to creating health problems for our kids, much like you've just described. And it's extraordinary how high the health problems are, and the fact that these are all related. That some of the same drivers of physical health problems like obesity and hypertension, also contribute to mental health problems and whatnot. One of the things that I don't think we have talked about nearly enough, I would say hardly at all in America, is the fact that the types of communities that we live in, in other words, like literally the physical environment and how communities are constructed, has a massive effect on personal health. Why is it that when you walk through the streets of New York, you don't see many people who are obese? There's one reason: the subway. And we don't talk about that at all. But the types of transportation systems that we design influence the types of communities that develop. Are they walkable communities, or are they sprawly suburban places where you get in a car to drive down the block? And that alone, that one single factor, has a massive impact on individual health. If you are simply walking about in the neighborhood versus taking a car, it has a massive impact on your health, but it also has an impact on things like your sociability. Are you in a community that has a lot of people that you interact with on a regular basis? Is it a diverse community? Is it a community that you can only access if you have a certain income level? Because all the houses in your sprawly, suburban development look exactly the same, which therefore means everybody who lives in your neighborhood is exactly the same. Or do you live in a place like New York City where you can have billionaires living right down the street from people who are in poverty and everybody gets to know each other? Literally has a big effect on the types of politics of a place. Is it a place that is more, is it a city, is it an environment, is it a community that is more tolerant and understanding of different perspectives? Or is it a place where everybody wants to think the same? So one of the biggest drivers of the problems we have with health in America is literally our interstate highway policy and the fact that we invest so little in rail and transit. And that's something that, especially in places like Kansas City, I think we really need to think about. I might be the only one who's saying this right now, but there are studies out there that show this, and it absolutely is something that we need to discuss more broadly. David wants to get in here.
I don't want to get in here. I'm getting the big red stop sign. So I want to just end by thanking
Members
Congressman
of
Moulton
Congress
for
are
joining.
very good at going over.
Oh, yeah, we appreciate your ability to do so. We appreciate your joining us today. So please let's say thanks again to Congressman Moulton and continue.